So what this is going to be is just an explanation of the anatomy of the fetal skull.
Okay.
Okay?
So here's a 40-week fetal skull, and we've taken the mandible off the face. So the mandible comes off here, and we have the frontal bone, we have the two parietal bones, and we have the occipital bone. And the frontal bone and the parietals are separated by the coronal suture, and the parietals and occiput are separated by the lambdoidal suture. Here you have the posterior fontanelle, which there's not much of one on this one, and the anterior fontanelle. Then we have the temporal bones that hold the ear, and we have the zygomatic arch that comes up into the maxilla on both sides. So these are the main things. We have this coronal suture that comes all the way down on the frontal bone and changes right here on the facial part into what's called the mitopic suture. So this all looks like it's one bone in the adult, but you can see there's this remnant of being two bones brought together. Okay, then we have underneath here, we have the occipital squama is here, and then the occipital condyles are here, and the occipital basilar portion of the bone. So when the baby's born, you have four parts to the occipital bone. You have the squama, the condyles, and the basilar part. And so this is really important because it gives a lot of movement in this whole area to be able to move. And it comes into relationship to what's called the sphenoid. And then we're going to take the top off here, and you can see it a little bit better in here. Here we have the occipital area, and you have the condyles and the squamal, the basilar part coming into relationship with the sphenoid right here. You can't really actually see it, but the line is about right here. And this is a really important juncture. And then you have the sphenoid bone, which is the lesser wings right here, and then you have the greater wings that are down here. And the greater wings you can feel on your own if you touch your temporal bones, what's known as your temporal bone, your right here in your temples, then that's your greater wing of your sphenoid. Here is the petrous portion of the temporal bone. And this is really important because this is where the tentorium comes around here and attaches on the petrous ridge and into the sphenoid. Right there. Any other questions?
Okay, so how does the sphenoid relate to birth?
So the sphenoid, and I wish I had the separate bones here, but the sphenoid and the occiput come together right here at the sphenobasilar junction, or the SBJ. And what can happen is the skull has physiological movements that it can make. So it can make things such as rotation. So maybe the occiput will go one direction and the sphenoid will go in the other direction, and that's called that's a rotation, or it's a torsion. But physiologically you can do that. And then you have maybe what's side bending, so you might have the occiput coming this direction with the sphenoid coming this direction, so it gets tight on this side, but this side will bulge out, and that's called a side bend. And whatever side the bulge is on is the name of the side bend. So for this baby, this would be the baby's right side bulging out, so it would be a right side bend. Those are physiological things that help the baby's head get out. Now there are some things that are non-physiological that are really pretty tough. So whenever you have what we call a shear, so when the occiput goes this direction and the sphenoid goes that direction. That's a non-physiological shape, and that's a little tougher to work with. You don't want shears. And that, all of these are, of course, in relationship to the movement through the pelvis, often. Sometimes it is prenatally in the way the baby sits, but oftentimes these happen when they go through the cardinal movements to be born.
So the occiput includes not just the sphenoid of the occiput, but the occiput goes all the way around the center. Show me exactly what the occiput is.
So the occiput is right through here,
Uh-huh.
right behind this petrous ridge,
Uh-huh.
because you have the temporal bone comes into relationship with the occiput in this area right here.
Uh-huh.
So here is the occiput. You have the basilar part meeting up with the sphenoid, the condylar parts which sit on the atlas, and then the squama part right through here, the biggest part. So we'll show you on the outside. Here's the squama, the condyles that sit
And those are all part of the occiput.
There's 4 specific parts that will come together later in life. There'll be more ossification of these areas. But at birth, they are very separate places and can be moved very easily. So this is an area that is often worked on with babies who, need some help. If you can see this foramen right here, this is where there's a lot of cranial nerves that come through here, and also one that's called the vagal nerve, which goes down through the body and innervates different organs, very specifically the stomach can go down that far. Vagus means the wanderer, so it's this long nerve. So if you can see, if this gets pinched up, then you might have a baby that's colicky or fussy or having a hard time. So you want to just make sure that these are balanced, these foramen are open, that the baby's atlas, is sitting on these condyles, because that's what helps the babies, how we get movement in our head, being able to go back and forth.
Okay, thank you.